Welcome, everyone. Hi. Welcome to our Corporate Experiences Healthcare Series featuring a virtual field trip to Sequoia Hospital. My name is Dee Dee, and I am your host from Wender Weiss Foundation for Children. And we are partnered with Dignity Health Sequoia Hospital to bring you this event. Let's dive in, and we are going to kick things off with a welcome from the Chief Medical Officer of Sequoia Hospital, Dr. Dieter Bruno.
Hi, I'm Dr. Dieter Bruno, Chief Medical Officer of Sequoia Hospital in Redwood City, and I'd like to give you a warm virtual welcome. Sequoia Hospital is a community hospital, and it's considered one of the crown jewels of Redwood City. Sequoia Hospital was started in 1950, and it has a long history. In fact, this year we're reaching our 70th anniversary of Sequoia being in the community. One of the things that we appreciate about a community hospital is it gives us the opportunity to have a number of different service lines that take care of patients of not only our community, but surrounding communities. We have a lot of strong individual departments, such as our cardiovascular, medical, and surgical departments, our surgical service lines, our OB service lines, our general surgery lines, and we have a number of interesting facets to technology that we use. We're most excited, however, about our opportunity to interface with the community to teach students, whether or not it's nursing students or physical therapy students. Many times we have people who are in medical school and they come and they learn and shadow and get opportunities to see really what we do and what we do well. I'd like to specifically highlight one of our service lines of which we are extremely proud, and that's our Heart and Vascular Institute. Our Heart and Vascular Institute is comprised of both cardiothoracic surgeons as well as a number of cardiologists, and we have a long history of being able to deliver fantastic care to patients from all over the state of California. We have great leadership in our cardiology department by Dr. Gregory Engel, who you'll be able to spend some time with during this virtual tour. And I'm sure that he will give you a wonderful opportunity to see our facilities and a number of the different ways that our service lines not only engage physicians and nurses, but also a number of the other workers that we need in order to get our jobs done. At Sequoia, we consider ourselves a family. And as a family, we value every member of the family. And we have a wonderful environmental services department that allows us to keep this place clean and functioning well. We have great facilities management that keeps this place spick and span and all of the equipment running. We have something called Biomed that makes sure that all the equipment that we use are up to date. And the number of different contributions from many different areas is fantastic and phenomenal. It's our hope that you realize that every area that touches healthcare is important to us, and it is really important for us to invest the resources into making sure that all of these different areas and service lines do well, and that we continually find new sources of students and education so that we can keep this place functioning as a high reliability organization. And one of our mantras is to keep me safe. Everything that we do is really centered around the patient. And that's something that we always like to highlight, because if we can't take care of patients well, then we're not doing our job. So sit back, relax, and enjoy our virtual tour. And we look forward to showing you everything that Sequoia is made of. Thank you.
Hi, my name is Greg Engel. I'm the chief of the cardiovascular department here at Sequoia Hospital, and I'm excited to join you today to talk about cardiac procedures and give you a tour of our cath lab that I'm standing here in front of. In the cath lab is where we perform most of the procedures on heart patients. I'm what's called a cardiac electrophysiologist. I focus on the electrical system of the heart, and the procedures I do are related to electrical problems, and we'll talk about some of those. Some of my colleagues who work here are called interventional cardiologists. We refer to them as the plumbers. They open up the blockages while I'm the electrician for the heart. We're going to take a tour. We're going to talk about some procedures. Come join me. The cardiac cath lab at Sequoia consists of 6 rooms, which are on either side of me here, that allow us to do a number of different procedures. As I mentioned before, we have electrophysiologists and interventional cardiologists doing procedures. In addition, we have other specialties who work here. We have vascular surgeons, interventional radiologists. We sometimes have our cardiac surgeons in here assisting with procedures. This allows us to do a broad variety of things. We're going to talk about a few of those procedures right now. I'm standing outside of one of our cath labs that's focused on arrhythmias. I'm going to take my mask off since we're filming after hours and no one's around. Arrhythmias are abnormal heart rhythms. There's several different kinds. Most of them are when the heart goes too fast. The most common arrhythmia that we treat is called atrial fibrillation. It's actually the most common serious arrhythmia in the world. Atrial fibrillation is when the upper chambers of the heart are beating very fast and irregular. Normally, your heart has a sinus rhythm. The beat starts at the top, goes down through to the bottom in a very regular fashion. In atrial fibrillation, the atria, the upper chambers, and you have two upper chambers, usually coming from the left atrium, starts to beat very rapidly and very irregularly. It can cause your pulse to go fast, you can get lightheaded, dizzy, short of breath, and there's also some serious consequences to atrial fibrillation. Because of that rapid beating, blood can pool and people can have strokes. On the upper part of this image, you can see normal sinus rhythm. That's the regular rhythm of your heart. It's very regular. There's a small bump, that's the upper chamber contracting. The large deflection is from the lower chamber, and it's a very even, steady pattern. On the bottom, you can see atrial fibrillation. That irregular, chaotic, up and down signal across the tracing shows the chaotic beating of the upper chamber. And the tall deflections are the lower chamber, but there's no rhyme or reason, very irregular pattern. One of the ways we treat it is with an ablation procedure. An ablation is essentially to go in and burn or cauterize tissue to stop the arrhythmia. Let's go inside and I'll show you how we do it. Arrhythmias such as atrial fibrillation and other arrhythmias can be treated in multiple ways. We often use medications for these patients, and sometimes medications are enough. But some patients need to come here for procedures like an ablation. This is one of the rooms where we perform the ablation. Obviously, we don't have a real patient here. We have a fake patient for you today, but this is where the patient would be. This is the fluoroscopy equipment or the X-ray equipment that allows us to see inside the body. Right here is an image of what the X-ray looks like. Here's an X-ray of someone's heart. You can already see one of our catheters. It's a plastic tube that we put inside the heart. It has little metal electrodes on it that allow us to measure the electrical activity and essentially see the electrical signal inside the heart. And if you look up here, that's actually an image of what an electrical signal from inside the patient looks like. Once we get our catheters inside the body, we're able to manipulate them and move them around. And over here you can see an image of what it looks like in 3 dimensions inside the heart. That's an image of just the left atrium of the heart. That's where we work on the heart for atrial fibrillation. And I'm going to talk in a little more detail about how we do that. This is one of the catheters we use inside the body. We insert the catheter into a small incision in the leg around the groin area where there's a large vein where we can go pretty much straight up to the heart. Once the catheter is in that vein, we can maneuver it inside the heart and get it to exactly where we need it to go. There's a lot of range of motion. This is a circular catheter that we use to map. And if you see carefully in there, there's little metal electrodes on that catheter. There's actually 10 pairs of them that allow us to measure the electrical signal. Now I'm going to talk about one of the coolest pieces of technology that we use, a 3-dimensional mapping system. So once we get the catheters that I showed you up into the body, we go up through the leg, up into the heart. This technology allows us to see the heart in 3 dimensions in real time. What you're looking at is an image from a patient this week. This is just one chamber of the heart, the left atrium. The 4 tubes you see are the pulmonary veins. Those are draining blood into the heart from the lungs. And the catheter you see is very similar to the circular catheter we looked at. This is a spatula-shaped catheter. And we're rubbing it along the inner surface of the heart to actually develop this 3D picture and measure the electrical activity. And this is in real time. That's as you move the catheter inside the heart, you see it move around. And this allows us to map out and plan our procedure. We're standing in the back of the ablation room we were just talking in. In addition to the ablation procedure itself, there's a lot that goes into this, a lot of technologies we're using, a lot of people involved. We do EKGs on patients, we hook up electrodes to see the electrical signal of the heart. We showed you in the ablation the inside signal. We need to see the signal from the outside of the heart on a surface electrocardiogram, just like you get one in the office. We also do echocardiograms to show images of the heart. We'll do that before in the office, during the procedure, and sometimes after the procedure to look at the structure of the heart. Here's an echo machine right here, one of the pieces of technology we use to get those images of the heart and make sure the heart's moving normally and the valves are functioning. These are all important pieces of getting a patient ready and keeping a patient safe during our procedure. When we think of heart rhythm, we're talking about how the heart beats. We use certain terms. When the heart's too slow, we call it bradycardia, slow heart rate. When the heart's too fast, we call it tachycardia, fast heart rate. Sometimes these are quite abnormal and we have to treat them, and we're going to talk about some of those ways. But why don't we do a little interactive project together? So we're going to have everyone check their pulse. Okay, there's a couple ways you can check your pulse. Most people, if you hold your wrist, this side of the wrist is we call the ulnar side. This is the radial side. You have a radial artery right here below the thumb. And if you push down right here, in most people you can feel a pulse there. That's one way of getting your pulse. In some people you can feel a pulse right on your forehead. A little pulse that's right near the surface. You can also check the carotid artery in the neck. We're usually a little cautious. Don't push too hard on your neck. But let's all check our pulse together. So we're going to give you 15 seconds on the clock. You count each beat during that period of time and multiply it times 4. So everyone go ahead and find your pulse now. On the wrist, under the thumb is usually the easiest spot. We'll time all of us for 15 seconds. Everybody ready? Ready, set, go! Don't worry if you couldn't find your pulse. You can always check it later, and I promise all of you have a pulse. Now take the number of beats you counted in 15 seconds and multiply it times 4 to get your beats per minute. For example, if you measured 15 beats in 15 seconds, that's going to be 60 beats a minute. The official normal is between 60 and 80, but don't worry if you're below or above that. Below 60, especially if you're athletic, is going to be quite normal. People are very commonly, when they're young, in the 50s, occasionally even dropping to 40s, especially at rest, and that can be quite normal. Above 80 can also be normal at times. If you're way below that, especially if you have symptoms, or way above it, sometimes you need treatment. For those patients who have low heart rates, when it gets too low, sometimes they can get lightheaded, they can get short of breath, they can have trouble with activity, and there's not much in the way of medications that will often fix that. So what do we need to do? We put in a pacemaker. A pacemaker is a device that speeds up the heart rate. They're very smart devices these days. They watch each beat, and they trigger when your heart needs to beat, an as-needed or on-demand pacemaker. The pacemaker is a small metal box. It goes in the chest area, in the upper left chest usually, and there are wires or leads that go into the heart. Most pacemakers are dual chamber, where one lead goes to the upper chamber, the atrium, and the other lead goes to the lower chamber, the ventricle, and they coordinate the heartbeat. I can show you an example here of what a pacemaker looks like. This is a model, of a dual chamber pacemaker. The leads go in the top, and this is the part that sits up in the chest. For some patients whose hearts go too fast, who have dangerous arrhythmias, some people who've had prior heart attacks or have a weakened heart, their hearts can race so fast that the heart essentially stops beating. And this arrhythmia is called ventricular tachycardia or ventricular fibrillation. It can be life-threatening. For those patients, we put a device in very similar to a pacemaker, but we call that a defibrillator. All defibrillators are capable of being pacemakers, but the defibrillator function allows it to deliver a large electric shock to stop those dangerous arrhythmias. Defibrillators, very similar to pacemakers, have leads that go in the heart, and our boxes are just a little bigger and a little thicker than a pacemaker. But they're put in very much the same way, and they provide that extra protection like a built-in emergency room in your chest. When most people think about heart disease, they think about blockage of the arteries. Turns out we have arteries that run on the surface of our heart that supply the blood to the heart muscle itself. When those arteries get blocked, usually by plaque and cholesterol and buildup of atherosclerosis, which can get progressively worse, and even you can get sudden rupturing of the plaque that blocks an artery. When an artery is blocked, we call it a heart attack or a myocardial infarction, nicknamed MI. What does that mean? Myocardial refers to heart muscle. Infarction means death of tissue. When an artery is completely blocked, the muscle behind it dies, and that causes a heart attack. If the artery is narrowed and there's not enough blood flow, we call that ischemia. That's a lack of blood flow. That can cause chest pain. And the fancy word we use for chest pain related to the heart is angina. Our primary goal is to prevent this from happening. There's a lot of things we can do. There's medications we can give people at risk. We can work on diet and lowering cholesterol, sometimes with medications if diet doesn't work. We can talk to people about losing weight. We can avoid smoking. These are some of the major risk factors in society that can help prevent these things from happening. When we're not able to prevent them, we sometimes end up in a room like this. This is one of our cardiac cath labs where we do procedures for blocked arteries. We call the procedure a cardiac catheterization, putting a catheter in the heart, or angiography, looking at the blood vessels. Catheter goes up through the leg, similar to most of the procedures we do here in the cath lab. And we go into the opening of those coronary arteries and we inject what's called contrast material. Under an X-ray camera, which you can see here behind me, we use the X-ray images to see that contrast material. And that just allows us to see the inside of the arteries. If there's a blockage, you'll see a narrowing of that artery. Once we see the blockage, we can go in and treat it. The way we treat it is essentially to open up that blockage. We can do what's called angioplasty, and that's when we put a balloon in to open up the blockage. And that these days is almost always incorporating a stent, which is essentially a metal scaffolding that goes up and keeps that blockage from reaccumulating and compressing back down. So you essentially do the angioplasty, which is the balloon, and that expands the stent to open up the blockage. And that's the primary way both acute MIs, acute heart attacks, are treated, by opening up a complete blockage, and also people who are more stable, who are having anginal chest pain. We can go in and put a stent in and open up their blockage and improve their symptoms. To take care of patients, it takes a team. It frankly takes a village. There's a lot of members of the healthcare team, and everyone plays an important role. We're excited today that you're going to get to meet some of those members of the team. Today you're going to meet a medical assistant, an echo technician, an administrative assistant, and a finance manager. Let's go meet them.
Hi everyone, my name is Maria. I'm the administrative assistant at Sequoia Hospital Health and Wellness Center. I started working at Sequoia Hospital before I graduated high school back in 2015. I started working there as a student clerk before I got promoted to administrative assistant. I decided to work in this department because before I graduated high school, I actually was interested in going into the medical field. I wanted to go into college and get my nursing degree and just, be a nurse at a hospital. I wasn't really clear what I wanted to go into. Then when I started at Sequoia Hospital, after taking a few classes at Kenyatta College for nursing, I decided that wasn't the major I wanted to go into. So I ended up switching my major and trying out the medical assistant program at Kenyatta. And when I started taking the medical terminology class at Kenyatta, I decided that wasn't it either. So I decided to switch my major. Right now, I'm a month away from receiving my associate's degree in administration of justice from College of San Mateo. And I'm the only one right now that is still in school and close to graduating. My parents, they migrated from Mexico. So I was actually born in Mexico. And I moved here when I was 9 years old. Still, my parents don't have the experience of going into a job interview or building a resume or anything like that. So I had to, be independent and kind of learn all of those things just on my own. And with being with Sequoia Hospital, I've actually had a lot of help from them. I learned to see them more than coworkers, as a family, because now that I'm close to graduating, they've kind of been the ones that have been putting me, helping me along the way with school, with work, with being flexible with my classes and my school schedule. They've always told me, school comes first. If there's anything we can do to help you, we're here for you. And they've been, that support that I couldn't have at home. I actually found it at work with them. So throughout this 5 years, if I was to be asked what is one thing that I like most about my job, there's definitely not one thing at all. I was very blessed, I could say, to be able to do is to be here at the hospital and help our CSU unit during the pandemic while the hospital was shut down. I was able to come up here and to work at that unit and be really close to the nurses and doctors here. So it's one thing that I never thought I would be able to do because I don't have the medical background to even, be working at a hospital, you would say, at the hospital building. But with my administrative assistant skills, I was able to come up here and also help the nurses and the patients here with answering the phone and transferring patients' family members to their rooms because, as you know, a lot of hospitals aren't taking in visitors. So I was able to transfer those family members to the patient to communicate them with the nurses and the staff whenever they had questions. I was able to help the nurses with, whoever needed help in the rooms to tell them, a room 103 needs your assistance or somebody needs help. I was able to be here and help them and also see how close the pandemic hit our staff here at the hospital. So it was really an eye-opener for me, I would say, and it's something that, even though right now I'm not graduating in anything that has to do with healthcare, definitely helping during the pandemic here really opened my eyes to know that I still want to do something in healthcare.
Hello, my name is Christopher Short. I'm the lead cardiac sonographer, or echo tech, for Silicon Valley Cardiology. I'm responsible for providing accurate ultrasound images for the doctors and excellent patient care. I come from a single mother household with lots of challenges. We lived in motels, hotels, homeless shelters, and I never wanted to experience that or let my children experience any kind of poverty like that, so I was very self-driven. I worked at Best Buy for 5 years after high school, and I went to San Francisco State University and City College of San Francisco to study cardiovascular technology at the same time I was working with Best Buy. Learned lots of skills working at Best Buy, communication skills, some business acumen, sense of integrity, and just the overall desire to help people understand their technology needs. I would like to take the time to ask and answer a few questions. First question, what or who inspired or motivated me to get into this career path? I would say it was Dr. Stephen DeGallen. I was able to make the journey into cardiovascular technology because of him. My wife used to work as a chart preparer for him, and I would come down to the office on lunch breaks, talk with him and visit with him and hang time with my wife as well. He knew that I was into technology. He also knew that I helped take care of my grandmother who was paralyzed. So he did a wonderful job of fusing both patient care and technology for me into this wonderful career path called cardiovascular technology. Second question, what qualities or personality traits do you think are most important or helpful in your role? Personally, I believe that compassion, patience, sense of humor, self-drive, and pride are all very important for a cardiac sonographer. Compassion. We need to remember that people are here looking for answers for some kind of sensation that they're feeling that's new to them, or they're recovering from some kind of traumatic experience. We need to understand that and be there to help guide them through this time. Patience. Again, people may be dealing with some difficult things, rehabilitating from traumatic procedures, dealing with the unknown, and they're scared and nervous. Sense of humor goes back to dealing with patients. Remember that we're dealing with people and not just another test at 10 o'clock in the morning. Get to know them, make them feel human, laugh, talk, joke. Again, this is not going to be the last time we see this patient. Develop that relationship and they'll be glad to come back and see you. Just a few more moments here. I have our ultrasound technology up. It's a picture of a heart there. We use a transducer with ultrasound jelly that we apply to the chest and take some live videos and still frames for the doctor to review. Thank you for your time.
Hi, my name is Mercedes Espinosa. I am the manager of finance at Sequoia Hospital. My responsibilities include development and implementation of the operating budget. I assist in month-end financial close process. I also assist the preparation of monthly flash report for our CFO. I work with daily productivity for our departments. My background and education is as follows. I was born in Aguililla, Michoacan, Mexico, and I lived there until I was 12 years old. I started school when I was 6 years old in Mexico and loved learning and found that I always wanted to be the best in my class. Not always achievable, but I really tried. My parents moved the family to the United States when I was 12 years old. At that time, I only had 3 brothers and a little sister. We moved to Redwood City, and I started elementary school for the last 2 months of the school year. I then moved myself, and I enrolled myself to Kennedy Junior High because I wasn't enrolled. I just showed up, and they had to enroll me. I graduated there 2 years later, and then I went to Sequoia High School for 4 years. At that time, I knew that my parents couldn't afford to send me to the university, so I enrolled at Cañada College for 2 years. I then transferred to San Jose State University, and I was able to obtain a Pell Grant and a Cal Grant, which helped with the cost of the university. I, however, I only studied for 2 semesters at the university and dropped out because I felt like I needed work experience. At that time, I was able to get a part-time job at Sequoia Hospital in the accounting department. And it was supposed to be 4 hours a day for only 4 months. And I stayed there 35 years already. I love to work with numbers, but I got married and had 2 children, but I never gave up on finishing my degree. Thus, it was 12 years later that I enrolled at the University of Phoenix, and I was able to obtain my bachelor's in business administration. It took me close to 3 years of going to night school, as I also held my full-time job in the daytime. I will answer 2 questions. What do I like most about my work? I love working with numbers and assistant managers to understand the various financial reports that will help them make better decisions. I feel that my work makes a difference and that I'm helping others. The other question is, what and who inspired me to motivate me to pursue this career? I would have to say it was my mother. My mother is the smartest woman I know. She didn't go to school because her father died when she was a little girl, and her mother put her to work instead of sending her to school. However, she did learn the alphabet as a little girl and taught herself to read and write as an adult. She was not able to help me with my homework, but she always encouraged me to do it myself. I learned budgeting because of her. Not that she was trying to teach me anything directly, but when I was 7 years old, my mom gave me 100 pesos and a list of items that I needed to get from the supermarket. I had to memorize the list because she really didn't know how to write it very well. So I found that I was really good at doing that kind of job. I was able to buy all the items that she asked me for and was able to also fit in my budget some treats for myself and for my siblings. So I have other people that I really admired throughout my career, but at the top of the list is my mom. Thank you so much.
Hi, my name's Yvette. I'm a medical assistant at a cardiology department. Some of my daily goals and tasks include doing EKGs on patients, putting heart monitors on patients to check what their heart rhythm is. I grew up in East Palo Alto. I went to a public charter school in Redwood City called Everest. After I went to Everest, I went to Sonoma State for about a year and a half because our goal was to go to college at that school. So they really emphasized that. So I ended up going to Sonoma State. I ended up coming back after a year and a half. It just wasn't a good fit. It didn't end up working out for me. I ended up not knowing really what I wanted to do, but I felt this kind of sense of urgency to be productive. So I ended up working 4 jobs. I ended up working at a after-school program, at a hookah night lounge. I ended up working at a real estate agency, and also serving lunch for the Palo Alto School District. So I did a bunch of different things. My goal was kind of to get a different taste for different things, to figure out what I liked. My friend had told me about a job train and a medical assistant program there. He recommended me to look into it. I did, and I started the program because it seemed like something I could do. I ended up falling in love with it, and it was really a really great experience. The application did take me really long to complete, but it was definitely worth it for sure. I'm very content with where I am. I'll be answering a few questions and answers. So what qualities or personality traits do you think are the most important or helpful in your role? I think there's a few important qualities that are really important as being a medical assistant. The first one is taking initiative. We want somebody who is actively looking for things to do. If you have a set amount of tasks you have to complete, kind of planning it out and mapping it out yourself is really a good quality that we look for. Also, communicating effectively and clearly is really important, especially in the medical field. You just want to make sure that nothing gets misconstrued or kind of confusing. And then we also want someone who's a team player, somebody who's working with the group to achieve the same goal, which is to give patients the best quality care. The last thing I would say that is really important is being curious, asking a lot of questions even though you may have asked the question before. Taking notes is really important as well, just so that way you have that information and you can just look back and kind of study it, and that way you're prepared. The next question is, what recommendations do you have for high school students who are interested in this role or who are interested in getting into healthcare? If you're interested in becoming a medical assistant, I recommend kind of looking up the job description and kind of getting an idea of what it's like. Even though a medical assistant, you can work in a variety of departments. Depending on which department you're in, kind of just depends on what you'll be doing. So say, for example, in cardiology, I do EKGs, place heart monitors, and things like that. But there's other departments where you would be doing different things like urinalysis, blood draws. It just depends. So doing research would be a really good thing to do, as well as getting your foot into a medical facility. Say, for example, by volunteering. You can volunteer at Sequoia or Kaiser, and they have applications you can fill out to help volunteer. So one more thing, if you are interested in becoming a medical assistant, one of my daily tasks is doing EKGs on patients. What we do is we'll attach these electrodes to the patient. It'll mostly go on the abdomen area. One will go on each arm and one on each leg. After we do that, we'll go ahead and get the patient connected to the machine, and then it'll show us on the machine what their heart rhythm is doing in that moment, and what heart rhythm they're having in that moment. But it's solely based on the electrical activity of the heart. Bye, thank you.
Hi, welcome back. I hope everyone enjoyed the tour of the cath lab, as well as meeting our healthcare professionals, our panelists, hearing their stories. We are now going to transition over to our Q&A, which will be led by Dr. Engel, and along with our panelists and healthcare professionals, Mercedes, Chris, and Maria. Unfortunately, we were not able to have Yvette with us today, but luckily, we are being joined by one of her colleagues and another terrific medical assistant, Julia Torres. So I'm going to let Greg take it away from here, Dr. Engel.
Okay. Well, I hope everyone really enjoyed the video and getting to hear from our guests. And we're fortunate to have 3 of the 4 you just saw videos on, and very thankful for Julia for joining in. I'm going to be moderating the discussion. We received a ton of terrific questions. Obviously, we're not going to get to every question that came in. There were a few extra that came in during the chat, but we're going to go around and ask some questions. I'll answer later some of the questions posed to me, but let's get going. All right, we're going to start with Maria. So let's start with, I'm going to give you a couple of questions. We'll start with, what's the favorite thing you get to do working at Sequoia? And the follow-up is going to be, what's a challenge you've had to overcome at work?
Okay, can you guys hear me okay?
Yeah.
Yeah, okay. Wow. If I had
Start
to
with
pick
favorite.
something, one of my favorite things that I like from here is definitely the community work, being able to help out in the community, not just by being out, but also here over the phone with patients and new moms and everybody that, you know, is just interested in the hospital and needs to get services done with the hospital. That's definitely one of the things that I really enjoy, just the helping out part. That's something that I've always liked. A challenge. I mean, a challenge, I would say it kind of just depends on you. I honestly enjoy everything I do, but it kind of depends on the person. You know, there's some things that you might not like doing, and that's just your own personal way of doing things. For me, I've really enjoyed everything I've done, and I don't really think I have anything challenging here. Because I see everything just as a learning experience. So if there's something that I don't know how to do, and once I learn how to do it, it's just like, oh, okay, well, now I can add something else to my things to do. But other than that, I just enjoy my whole work experience here.
That's great. That's great. All right, we're going to keep going around. I'll come back. Chris, let's jump over. So also a multi-parter. What is the training required to become an echo technician? What type of school, and how long does it take?
So can you guys hear me?
Yes.
Yeah.
Okay. The length of time is roughly like 2.5 years. You need your preliminary courses, your college level English, college level math, anatomy, physiology, which can all be done in a semester or so. And then you can go into 2-year specialty course training, solely driven around adult echo. There are other modalities you can study, but for adult echo, it's going to be about 2 years. And what was the last part to that question? I'm sorry.
Well, it was, what type of school do you go to? And then the follow-up is actually, do you know any of the schools in the area that happen to offer these programs?
Yes, for adult echo, I attended City College in San Francisco, which has pumped out a lot of echo technicians over the years. Still doing really great work over there. There's a few others that aren't specific to adult echo, but as a doorway into ultrasound imaging. You have Gurnick and a couple other junior colleges in San Mateo and San Jose around the area. But yeah, that's pretty much it.
Excellent. Thank you. All right, let's jump to Mercedes. Mercedes, first question for you. Talk about the day. I'll give you a 2-parter. Talk about the day in a life. What's your usual day? I know this is a busy time of year for you. You can fill us in on that. And then also part B will be, what's your favorite part of the job? So we'll set you up for a 2-parter.
Okay.
So my day is mostly computer work. So I'm sort of attached to my PC. I do a lot of worksheets. Uh, I look at data from the hospital, from patients, what they have done, who their doctor is, all that kind of information. I also, right now, I'm in the middle of figuring out the budget for fiscal year 22. Um, it's a new process. I don't know if you are aware, but we are now part of a bigger organization. So there's a lot of change in how we're going to do this budget. So we're a little behind from where we were last year. So, but I have to say, the day is mainly computer work with worksheets and also a lot of Zoom meetings to prioritize work with my director or talk to managers if they have questions. So that's mostly what my day looks like. And what I like about what I do is I'm in love with numbers. So I'm happy that I get to come here and work with all these numbers and make sense of them for people who are not into the number. So it's really, that's what I really like. I like working with the numbers, and then I like to explain the numbers to those who don't understand it well, and to help them make their case when they have to talk to their managers or their superiors. So, for example, when they're asking for a new position for a department, I can kind of give them a strategy, and I can give them the numbers, and I can explain them how to present them so that they have a good outcome. So that's what I like to do. Working with numbers and working with people.
Thank you. That's great. All right, Julia. Now, the group didn't get a chance to meet you through the video, so I'm going to give you a little extra time here and incorporate your first question, which is, what led you to your career? How did you choose to become an MA? But feel free to just sort of walk us through your background. You do the same job as a vet, but different backgrounds. So we'd love to hear about your background.
Yeah, so I started off right out of high school going to San Jose Community College. My plan was to become a physical therapist. I went to school for about a year and a half, kind of decided it wasn't for me. I got really stressed out and with money and just kind of the typical things that you discover when you become, you get out of high school and become an adult. I went into served for a couple years, and I wanted to start a career and, start my life. I didn't want to serve tables for the rest of my life. So I just happened upon a medical assisting program with Unitech, and started pretty quickly, actually within a month, met with some of the people at Unitech, started the application process, that took about 8 months of being in school. And then I did a month of externship with Kaiser, which was amazing. I worked in the pediatric department, and I fell in love with just helping patients and talking with them and just kind of making them smile a little bit and make them feel at ease before talking with the doctor.
Terrific. I'm gonna throw a follow-up question in. If you're going to give advice to a high school student who was interested in becoming an MA, what advice would you give them during high school to prepare?
I would say, I wouldn't worry too much about decide. I don't know. That's hard.
Okay.
Yeah. I would say just be open to a lot of opportunities with medical assisting, definitely, because there's a lot of different departments, like Yvette said, that you can get into, and a lot of different skills that you can learn. So you definitely don't have to be set on one thing. So yeah.
Great. All right, we're going to come back to you. Let's go back over to Maria. Now, I did get a question for you on pros and cons, but I can tell from your prior answer that the cons is not, there are no cons for you, which is awesome.
No.
But let me ask you this one. you did a really nice job of talking about some of the wonderful opportunities you've had due to the pandemic, some of the positives. Talk to us about the day in the life for a medical administrative assistant, irrelevant of pandemic, right? You know, what's the usual job description?
I'm gonna tie that one into one that I'm seeing on the chat here, some misunderstandings about our jobs.
Sure.
Because one thing that everybody thinks about when they say you're an admin, it's, you know, you're kind of glued to the computer and on the phone as well. But from the pandemic, I was actually able to be at the actual hospital and help in different departments. What I'm doing now too, with now the vaccines are out. So I'm actually helping out in the vaccine clinic over at Sequoia Hospital. And I'm also helping out with COVID testing out in the community. So other than being glued to emails and phone calls, I'm actually also doing other work outside of the office here. So that's something that changed with the pandemic. I used to do a lot of community things too before, but now I feel like I'm doing more out of my office than what I used to prior to COVID. But mostly, I would say, if you say a typical day here, it would be mostly here if COVID wasn't a thing now. I would mostly be here scheduling appointments and answering questions from patients and things like that. But now it's mostly out of here.
Well, would it be fair to say that being flexible and volunteering for opportunities has, you know, allowed you to be able to do all these things and is that how these things tend to happen?
Yes, definitely. Being open to the opportunities that you'll get. Like Julia was saying, don't think that, you know, you can only do one thing in the medical field. There's just a lot of different ways that one position can take you. So definitely be open to, if you want to start off, you know, as an admin or doing paperwork for an office or something like that, you know, take that opportunity, because that will definitely take you onto other things that you can't possibly imagine when you're just taking one job. So definitely be open to all of that.
Terrific. So let's go back to Mercedes, and I'm going to come back and ask everyone about how the pandemic's affected their job, because that question's coming up. I was planning that. So I'll swing back to everyone on pandemic questions. But Mercedes, let me jump in with another question that came in. And this is a question we could ask anyone, but I'm sure it came to you because you're the finance manager. But here's the question. Do you feel your job and your salary allows you to cover cost of living in the Bay Area?
I do. I think that once you get to a level like a finance manager, the compensation is pretty good. You even get a bonus. So, and also you know, I'm in budgeting. So you as an individual have to create your own budget and live within your own means. And I know the rents are pretty high, but, and I've been here, I had my house for 30 years now. So that's probably the highest cost of anybody. It's the cost of the housing. But I can say that yes, accounting pays really well. So
Excellent.
I really recommend anybody to go into accounting. Everybody needs an accountant.
Terrific. And then I'm going to add one. Maria already jumped in and addressed a good question that came in the chat. Common misunderstandings. Mercedes, do you think there's any common misunderstandings about a finance job that you want to address?
I never thought of any misunderstandings, but perhaps sometimes they may think that we're too much into the numbers and we may not be more compassionate, because, you know, we have targets we have to meet. But you know, every business needs to make a profit in order to continue. So some tough decisions have to be made. So I would think that would be probably the only misunderstanding, is that maybe accountants are not as compassionate as we should be.
Great, thank you. I know you're extremely compassionate, so I'm not worried. Okay, let's go back to Chris. So this is a great question. What is the coolest or most interesting, actually a couple people asked this, coolest / most interesting thing you've seen during a patient's echo study?
So the coolest thing, there's a lot of cool things you can see on an echo. I think the scariest thing, but also the coolest, is seeing like when there's a clot forming in someone's heart, and you can identify that and make sure the doctor's aware so they can get it treated and removed safely. But everything about echo is pretty cool, just seeing everything in real time. And then follow-up work after the doctor's done treating it, seeing how it looks after. That's always very, very interesting.
Excellent. And then I'm also going to give you the question that everyone that came in the chat was terrific, which is, do you think there's any misunderstandings about an echo tech job that you want to address?
Yeah, the misunderstanding is that people then think that I have some kind of medical training as a doctor because I can do ultrasounds and see and help diagnose disease and give it to the doctor. They think I know more than I do. And when I ask me questions, it's like, no, go see your doctor and talk with your doctor. But it's always fun hearing from people and giving some insight and saying, yeah, you should probably go ask your doctor about this.
Excellent. Great. All right, Julia, let's start with the misunderstanding question for you. Is there anything you want to address from the MA perspective?
A lot of patients tend to think that we are nurses, and that, like Chris, he said, they ask us for advice and everything, and so we just kindly ask, say, oh, you can save the question for the doctor. Just try not to give them too much advice because you don't want to get in trouble.
Or misinformation.
Or misinformation, yes.
Perfect. Well, I've got a perfect follow-up question to that. How do you interact with the staff you report to, such as the nurses or the doctors? Tell us about that.
Well, I talk to everyone like how I would want to be talked to. Everyone is a human being, I just talk to everyone like, normal and respectful and professional, of course. This is our profession, and we want to, yeah.
Excellent. Well, there's a question related, so I'm gonna give you one more question related to that. And then, what do you think are the most important skills in being a medical assistant? I think you may have hit on some of that, but tell us what you think.
I think it's really important to definitely be a people person, be able to have a conversation with someone and put them at ease. I think Chris was saying that earlier. You want to try to make the patient feel comfortable because they're coming in and they aren't aware, they don't know what they're walking into. You want to try to calm their nerves as much as you can. And yeah, just having a conversation and having a patient feel like you're listening to them definitely helps a lot.
Great. All right, I'm going to reverse the order. I'm going to go back to Chris, and we're going to say on a similar topic. Obviously, people skills are pretty important. We just heard about the positive skills. What happens if patients come in nervous and sometimes they're not on their best behavior? What if you have a rude patient? How do you deal with that?
You got to keep in mind that it's not a personal attack on you. They're just venturing off in the unknown and they want answers. Oftentimes I get asked, is this good or is this bad during a test? And I'm not at liberty to answer that. I have to allow the doctor to read and look at everything and diagnose it. So when I defer saying you have to save those questions for the doctor, sometimes patients are really upset about that. And again, it's just not a personal attack. They're just worried and scared. So you just have to have compassion and understanding and sympathy for them, but not to pity them, but like really trying to understand what it is that they're going through and put yourself in their shoes and how would you feel about that. So that's kind of how I address those things.
Great, thank you. All right, let's go to Maria. Similar question. What's the skill set? What should people be thinking about? What are the qualities that make you good at your job?
Definitely communication. Definitely having that people skill to interact with. You'll have difficult people come to you and they'll demand answers from you. So you need to be able to communicate not only with that person, but also be able to communicate with your boss and your coworkers. because I feel like that's the number one thing in the medical field. It's clear communication with everybody. So definitely have that. And I feel like if you're wanting to go into the medical field, you have a calling for it. So I believe you guys have the heart for that. So you'll be able to, if you have the heart for it, you'll be able to communicate with others. But definitely have in your mind that there's difficult people out there. So with every career, you'll have to face at least one. So definitely have that in mind to be able to communicate with other people.
Well, Maria, I'm going to stick with you because I'm just looking at questions coming in the chat. And you obviously are dealing not just with colleagues, but patients. Can you give us an example of a situation where you've dealt with an upset patient or someone who was upset and how you handled that?
I've had a few and different ones. So you definitely want to stay calm. The way that you talk to them, don't get to their level because that way you won't resolve anything. You definitely want to stay calm and know that you're the one that knows. So you want to make sure that you stand your ground and say, this is what I do for a living. So I'm the one kind of telling you and guiding you. Definitely stay calm. Try to talk to the person as calm as you can. And at the same time, tell your supervisors what happened and say exactly how it happened. Don't throw anything else in there and try to make it, a soap opera or anything like that. Actually say it how it happened. I've had a couple of patients come in. We deal with a lot with insurance, and as you guys know, insurances can be very difficult to know about. So we've had patients that get mad because their bill didn't come out right or their insurance didn't cover it, but we don't deal with that. So that's a thing for a patient to talk to the insurance about. And so at this point, you really want to explain to them what you know and have them understand that. At the end of the day, if you stay calm and if you get them to understand you, it won't be a difficult situation. So definitely learn how to talk to people. It's the number one thing that I can tell you.
Great. We got definitely a theme of communication. Well, let's go to Mercedes. Obviously, you've had to deal, people clearly, get upset when it comes to the financial aspects of medical care. And Maria hinted at that. Do you want to talk to us a little bit about how you've dealt with those situations and, the skill sets you rely upon?
Well, I don't have any interaction with patients. My customers are the department managers and department directors. And there's been times when they don't agree with some of the numbers that we provide, like when we're budgeting, how many FTEs you get for the year and things like that. But like Maria said, you just have to keep calm and explain what you know, why the numbers are what they are. And if they have a question or they have an issue with it, then they should go to their supervisors, their managers, because a lot of that comes from them. So
right,
that's how I deal with them, and I don't deal with patients though.
Oh, but patients or colleagues, it can be similar issues. Okay, I've got a follow-up question. This one's more potentially philosophical. If there was one thing you could change in the healthcare system, Mercedes, what would it be?
I would love for the healthcare to be free for everybody. I would love to see that everybody has the right to receive healthcare. The problem is who pays for it. And I think, so I don't know, I don't have the answer how that would work, but I would love to see everybody to get the health care that they need.
Great.
And of course, an ideology. I don't know when that's going to happen, but I hope in the future, our children or our children's children can figure it out.
Excellent, thank you. Chris, let's jump over to you. A couple people asked this question. Is there radiation involved in your job? Can you explain to us why or why not, and how does ultrasound work?
So there's heat energy that's coming off of the transducer. Over time, you may start to feel the transducer warm up. We use the jelly as insulation and a medium to image through, but there's no real radiation going on. It's just a vibration of sound waves that are bouncing off and creating an image. So the answer to that is no, but you do have some heat energy, if that makes sense.
Great, thank you. Julia, so talk to us about what other career opportunities exist for an MA. Where can you go from here? What are your plans?
So there are definitely a few different opportunities. You can become an echo tech like Chris, or you can become a nurse, or really almost anything. I personally, in a few years, do want to try to get into a nursing program, just to kind of have a little more responsibility and just try to, help patients a little more than I already do. I just want to definitely get into a better spot financially, and just be in a better spot to be able to focus on school and still be able to provide for myself.
Excellent, thank you. All right, I'm going to ask everyone some people have addressed it, but I just want to go around for everyone, pandemic related, and then I'm going to switch over and start answering some questions directed towards me, and I'll talk about the pandemic a little. Let's start with Julia, but the question is, we've heard a little bit, but just a couple examples of how your job has changed. Maybe it's the precautions you take or how you work in office, remote, things like that. Just give us a quick feel for that.
So right now, as medical assistants are pre-screening all our patients to make sure that they don't have any symptoms and that they're okay to come in, because we definitely don't want anyone with COVID infecting all our other patients, because we do have some sick people coming in. We're always wearing masks, so that's definitely changed. And a few of us are working remote. I'm working remote today, just to help get some of those calls down, because we are still doing our normal duties like rooming patients, doing our EKGs, placing monitors and everything.
Great, thank you. Chris, a question just came to the chat. I'm gonna have you address this one real quick before we do pandemic related. It's a good question. What's the worst thing that can happen when you're scanning someone? How much you have to trust the technology? What's going on?
The technology is really good. A lot of times it's technician driven. You can have multiple people scan the same patient and things look different. It's almost like trying to write your name the same way in 5 different lines. It's not going to be the same exact time or look the same exact every single time. There's going to be a little variation, but that's accepted. I've heard of stories where patients have become somewhat violent during studies. They may not be all there mentally suffering from a disability and they don't know exactly what's going on, and may try and hit you or something. But most of the time it's just people being uncomfortable and being a little nasty verbally. It's pretty much it.
All right, and then can you address pandemic? When you do an echo, you can describe for people you're pretty close to a patient for a period of time. How do you handle that in the pandemic era?
So the pandemic has made it harder. In the video, I said that we want to try and communicate with people and treat them like people and not just a test at 10 o'clock in the morning. So we've had to reduce our conversation a lot, and we're all wearing masks throughout the entire test. And as Julia was saying, we're making a lot more calls, over communicating with patients. I've had people say, hey, someone just called me from the office, but I have a different set of questions or a different protocol I need to follow for stress echoes, where someone may be exercising on a treadmill and I'm in close proximity and they're trying, I have to test to make sure they're not COVID positive. So I have to get them tested and then come in and do their treadmill test. And it's just like an over communication right now, but it's better to be safe and over communicate than not be safe and someone catch it.
Perfect. And then Maria, anything you want to comment differently on day to day because of pandemic?
Definitely. So right now we're
close to the public. Right here where I am, it's our health and wellness center. So we do a lot of the classes for patients as well as outpatient appointments for moms that just deliver at our hospital. So right now we're not seeing as many patients as we used to prior to COVID. And also all of our classes have now been turned into online instead of holding them here in our facility. So definitely a lot has changed.
Thank you. Mercedes, you can comment on pandemic if you want, but a good question came in. Do you know of any scholarships or other things of that nature that might be available to students?
Well, I don't know of any specific ones, but I know that when I was in high school myself, which was a long time ago, they had the Rotary Club, and I'm sure the Rotary Club's still around. They used to offer scholarships. Another one would be there's student clubs in the school, and some of them give scholarships too. I got one that was called MISO. I don't know if that club's still around in Sequoia High School. It was Mexican American, something or other. And then I also got one from a church. So my resource was my counselor. I would go to my counselor and I would say, let me know of any scholarships that you're aware of, and I will apply for them. So I was able to get about 3 or 4 scholarships. Plus, I also applied for the Pell and Cal grants. So there's a lot of resources out there. You just have to apply for them. And my thing is apply for everything and see what can you get.
Great.
You'd be
Great.
surprised.
Thank you. All right, I'm going to keep an eye on the chat. I've had a bunch of questions that came in for me to address, and I'm going to try to shoot through these as quickly as I can. Hopefully I won't talk too fast here. But I'm going to go through a bunch of these, and then I'm going to come back to a bunch of COVID questions with, maybe a few minutes we have at the end. So I had several questions about what type of schooling to become a physician, to get to my type of specialty. So this is sort of the other end of the spectrum of long schooling. So I'll make this relatively quick, but I'll describe it quickly. So post-college, I had 12 years of training after college. So medical school is usually 4, some people go 4 or 5. If you're going to become a cardiologist, you do a 3-year internal medicine residency. I spent an extra year as chief resident. Then you do a cardiology fellowship, which is 2 to 3 years. And then I became an electrophysiologist, which is another 1 to 2 years. And some of the variation is how much research you're doing during that time, depending on what program you're at. But it was about 12 years of training. And for me, mostly locally at Stanford. And then I came out of training and started a job in private practice in 2006 and have been working out of Sequoia Hospital since then. I love it. It's terrific. And I will say, even though that sounds like an enormous number of years, once you finish med school and you're a resident, you're actually getting paid. You're not getting paid a lot, but you are getting paid something to do the job. The hours are long. I got a question, what's the longest shift? We'll just say 36 hours plus. It's better than it used to be. There are now rules where residents have to be given time to get some sleep, and you're not supposed to work 24 plus hours straight anymore. But I trained in a time where it still happened. It was getting better while I was training. We won't go into stories about, I never fell asleep driving, but I did fall asleep in my car before I left the parking lot for a number of hours once. Had some good questions about that. What inspired me to become an electrophysiologist? There are also some questions about, do you do surgery? Well, part of what I love about cardiology and electrophysiology is it's a mix of medicine and surgery. I do operate, I put in pacemakers, defibrillators, we do ablation procedures, but I also spend a lot of my time talking to patients, being a diagnostic cardiologist, figuring things out. So I love it. It's a mix of office, hospital, invasive and non-invasive. So I love that mix, and there's a lot of technology involved, which I love. And then there was a question about being chief of cardiovascular and difficulties and challenges in the job. Similar to what you're hearing from everyone, the theme of communication, in being chief, part of my job is reviewing cases and dealing with some medical aspects of the hospital, but a lot of my job is dealing with, administrative issues and politics. And communication is key, right? Dealing with colleagues who are upset, talking to patients who may be upset, you do as a physician, but also in an administrative job. So, quite frankly, the chief role is more administrative than clinical, than taking care of patients. Here, let's see, a couple questions coming up live. We'll do this. So now questions about technology in the cath lab. Question just came in. Have we always had the 3D technology in the cath lab? No, we haven't always had it. But that 3D mapping technology to do those types of complex AFib ablations around 2006 is really when it came into regular use, but the technology has advanced dramatically. And even in the last few years, it's improved and allowed us to make more complex maps and deal with more complex arrhythmias. So the 3D mapping gets better and better, but in the scheme of medicine, that's pretty recent, right? It's only a technology that's in regular use for 15 plus years. Some of the other questions that came through the chat. Yes, pacemakers are when the heart's too slow, it speeds you up. Defibrillators are when the heart's going so fast that it essentially can't beat and you have to shock it and stop that. Is the patient asleep? Not always. Yes, many times patients are under full anesthesia, they're totally asleep, they feel nothing. But we can actually put a pacemaker in with conscious sedation, the kind of medicines that are used during a colonoscopy, even at low doses. I've even had older patients decide to be wide awake. We numb up the area and you don't feel the movement inside the heart. There's no nerves feeling things moving, so it's just where the pacemaker goes in. So believe it or not, some of the things we do can be done awake, but some of them need to be under general anesthesia. Some questions about how do we maneuver in the body. Various different techniques, but a lot of the techniques when we go through the blood vessels, we lead with a wire that has a bend on it, like a J, that's nice and soft, so that it doesn't hurt anything as we go. And we use an X-ray camera and we can bend it and twist it to where we need to go. Let's hit a few more questions. I want to save a couple minutes for the COVID related stuff. What am I ever nervous? Was I nervous the first day? And do you ever feel like something's going to go wrong? Well, yes, of course, nervous the first day. And in my opinion, if you're never nervous, maybe this isn't the right job. And maybe nervous isn't the right word. You have to have an appropriate degree of anxiety and attention to what you're doing, because some of the things we do are very serious. And I think being a little bit anxious about it just keeps you focused and pays attention. But you, of course, have to be able to stay calm if something's going wrong. Primary focus, things do go wrong. One of the questions, has anyone's heart ever stopped? Do we have to restart hearts? It doesn't happen every day like on TV, but it does happen. And, you need to stay calm and focus on the patient. And after those situations, most of us sort of comment afterwards, like, okay, my heart stopped for a little while during that one. Facetiously, but yeah, you get nervous, but you learn how to stay focused. All right, and we're not going to get to every question, so we need to do a little wrap up. So I hope I hit some of the good questions there. And let's just talk COVID for just a couple minutes. As you heard, there's a lot of things that have changed in medicine related to COVID. But Chris mentioned for certain types of tests, like a stress cycle where you're breathing heavily and the risk is higher, you have to have a test within a few days before and know you're negative. Every surgical procedure we do at the hospital, you're tested before you come in, you have to be negative. Sequoia has done a great job with that. Also, COVID patients are completely separated from other patients who are coming in from elective procedures. So actually, we can be pretty comfortable in bringing people in if they need elective surgeries. Other than right when things started last March and April, where we shut things down for a while, we never fully shut down electives, even with the recent surge, because we were able to keep everything separate. We had to slow it down a little, but we never shut it down. A lot of protective gear, we wear N95 masks and face shields, whenever you're close to patients or high risk situations. Some are office and hospital. I see a lot of patients by video. That's new. We used to do almost everything in person. Now, for staff safety and patient safety, we do a lot by video, but other patients need to come in. We've always kept the office open, so you have to balance that out. Is it stressful? Is it safe? So if you take precautions, it's safe. And we fortunately locally have had enough PPE. We haven't had, crazy shortages that have occurred in some other areas of the country. Is it stressful? Of course, especially at the beginning when there's a lot of uncertainty. And then we're going to run out of time. There were a bunch of questions about the vaccine, and I'll just say this. The two vaccines that have been approved, the Pfizer and Moderna, have better data than anyone who knows the vaccine field ever would have expected. 95% was way above what we expected. The allergic reactions and things you've heard on the news is running less than 10 people per million, and they're not dying from it. Right? You know, some of them had to be hospitalized. So the risk is incredibly low. The safety is incredibly high. And compared to COVID, we've met as a group, as physicians, we can't come up with any patients who shouldn't get the vaccine. Several people asked about high schoolers and young kids. It's being studied. We need some data on kids under 18 and 16. It's going to be a while. It's going to be months. You know, the adult population first. My hope is over the summer, but that's a wild guess as far as people under 18 getting the vaccine. But that's obviously a relevant question to high school kids. But even with the vaccine, masks, hand washing, stay safe. It is time to switch over. I'm going to go back to our host, Dee Dee. Thank you, everyone. I hope I hit as many of your questions as I could.
Okay, I will jump back in here. Thank you to Dr. Engel and all of our panelists for helping answer so many terrific questions. And thank you to all of you for being here with us today. It's been our pleasure to be together. I do want to share with you a list of email addresses in case you want to take a photo. So just give me a moment to pull this up for you. There we go. And feel free to take a photo of this. If you have any follow-up questions for any of our panelists or for myself, we are happy to answer them for you. And in addition, right now, we are going to drop a survey into the chat, and we would love it if you wouldn't mind sharing your thoughts and feedback on the event and any suggestions that you might have. It's just a 3-minute survey. In the cases of both these email addresses as well as the survey, we will be sharing that with the teachers afterwards. And in addition, I will also be sharing with your teachers to share with you an entry-level healthcare job guide that has additional descriptions, videos, links, and other information about entry-level healthcare jobs that go that include the ones you've heard about today and go beyond as well. So we'll be sharing that with you later. But our hope is that you enjoyed the tour and hearing from our panelists today, and basically hearing stories from people who love what they're doing and might give you all some ideas for after high school of fields you may want to consider. Now I'd like to give a heartfelt thanks to the people who made today possible. Let me begin by thanking my partners from Dignity Health Sequoia Hospital, Marie Violet and Trisha Coffey. I would also like to give a shout out to Amy Wender, the head of Wender Weiss Foundation for Children, for continued support. And we would like to thank our partners from Sequoia High School Health Careers Academy, Stephanie Whedon, Greg Schmidt, and Ashley Gray. Huge thank you. We were very lucky to have the opportunity to work closely with Stephanie Whedon to bring this event to life for all of you, and it was a pleasure. We got to see the huge amounts of energy and creativity that she has. So thank you very much, Stephanie. I'm now going to pass the baton to Stephanie for a few final words, and then we'll say goodbye. So thank you again.
Thank you, Dee Dee, and everyone. Huge thanks to Dr. Greg Engel, Maria Perez, Chris Short, Mercedes Espinosa, Yvette Lopez. I know she wasn't able to be here in person, but thank you so much, Julia Torres, for stepping in, and you did great. just giving up your time to share your experiences and your stories and be vulnerable with us. I know that it's sometimes for us in school hard to talk about ourselves because you just do your job, right? And then you find out that there's a whole audience that you're inspiring to go into these fields. So it's just so amazing. So thank you. I also, like Dee Dee already said, I want to thank the dream team, Marie, Violet, and Trisha Coffey on behalf of Dignity Health Sequoia Hospital. Dee Dee, you're wonderful. You are so amazing on behalf of the Wonder Wise Foundation for Children and just as an individual. So it's been so great to be able to work with you all. So fun to work with, and I can't wait to continue this partnership together to continue bringing amazing resources like this one to our school and community. I want to thank members of the Wellness Advisory Council, esteemed members and staff of Sequoia High School and our district for continuously supporting us and helping us to be deeply integrated into the community. Like Dee Dee said, my colleagues at the Health Career Academy and Sequoia High School, especially Ashley Gray and Greg Schmidt, for helping to continuously move mountains for our ever-growing program. And last but definitely not least, I really, really want to thank our students who've taken time out of their hectic distance learning schedules, family responsibilities, and work to be able to invite us into their homes and take advantage of this amazing resource. You guys are incredible, and I can't wait to invite you guys in the future to a panel where you can talk about your amazing careers in the future.
Awesome. Well, that was perfect. Thank you, Stephanie. And on that note, thanks for a great afternoon and have a wonderful afternoon and evening. Thank you for being with us.